Welcome back, class. I am Dr. Kaban. Today's video presentation is part 1 of chapter 25. This is beginning in your textbook on page 436. Fluid, electrolyte, and acid-base balance. Again, I will bring this information to you into 2 video parts. Lesson 25.1 will review the content on fluids and electrolytes. And then the second part would be acid-base imbalance overview. Let's get started. Upon previewing my presentation as well as reading your chapter 25 in its entirety, you'll gain the following knowledge. You'll be able to discuss the various functions water performs in the body. You will be able to list the major electrolytes and the functions of each. You will gain knowledge and an ability to describe 3 ways in which body fluids are continually being distributed among the fluid compartments. And then you'll be able to identify the signs and symptoms of the common fluid and electrolyte imbalances. You'll gain knowledge which you can apply to the clinical practice setting. You'll be able to assess and assign patient for signs of fluid and electrolyte imbalance. From your patient's laboratory results, you will identify electrolyte values that are abnormal. You will be able to implement patient education for someone with hypokalemia. And also, you'll gain knowledge and skills in developing a plan of care for a patient who has a fluid and electrolyte imbalance. We will begin our review of fluid and electrolyte by discussing the composition of body fluids. Let's start with the discussion of water. The 2 largest constituents of the body fluids are water and electrolytes. Water serves 4 functions. Water serves as a vehicle for transporting substances to and from cells. It aids in heat regulation, assists with hydrogen ion balance in the body, and it is a medium for enzymatic actions of digestion. More than half of the body's weight is water. This amount varies certainly by the individual's age, sex, and health status. The adult male body contains 60% of water, whereas the adult female body, because of more fat tissue, contains about 50% of water. The infant and the older adult are affected more quickly and seriously by minor changes in fluid balance. Infants and elderly can become dehydrated more rapidly. The infant's kidneys are not as efficient as the adults, therefore their kidneys reabsorb less fluid. Elderlies have less antidiuretic hormones and diminished thirst sensation. Remember, water is critical to maintaining homeostasis. Table 25.1 in your textbook on page 438 shows sources of water and avenues of loss. Please take a moment to review this table. Some sources of water include oral intake, food, and metabolism. Avenues of loss include output in the urine, perspiration, feces, and expired air. Remember that I said earlier that the two largest constituents of the body fluids are water and electrolytes. So let's move forward with discussing electrolytes. Electrolytes are minerals or salts that are dissolved in the body fluid. They are measured in milliequivalents per liter. In solution, electrolytes break up into ions. Ions have electrical charges. Your cations have positive charges, and your anions have negative charges. Each cation must be balanced by an anion. The major source of electrolytes is diet. In this slide, we will review the common electrolytes and their functions. Please take a look in your textbook on page 438, table 25.2. Sodium. Sodium is a major cation of the extracellular fluid. Its major role is in the regulation of water balance and water regulation. Potassium is a major intracellular cation. Potassium is important in nerve transmission and muscle contraction. It helps maintain normal heart rhythm. It also helps maintain plasma acid-base balance. Calcium is involved in formation of bone and teeth. Magnesium is necessary for building bones and teeth as well. It is necessary for nerve transmission, and it is involved in muscle contraction. Phosphate is necessary for the formation of ATP. Chloride helps maintain acid-base balance. It is important in the formation of hydrochloric acid for secretions to the stomach. Bicarbonate is a buffer that neutralizes excess acids in the body. It helps regulate acid-base balance. Here we have your major electrolytes and their associated normal ranges. Again, take a look at page 438, table 25.2, and familiarize yourself with these normals. Your normal sodium level ranges between 135 through 145 milliequivalents per liter. The potassium normal range could be anywhere between 3.5 to 5 milliequivalents per liter. Again, familiarize yourself with these major electrolytes. Please note that ranges may vary slightly between facilities. Usually these values are the acceptable standards. Here we have examples of non-electrolytes. They are your amino acids or proteins, glucose, and fatty acids. Remember that they remain bound together when dissolved in body fluid. In the healthy individual who is eating normally, the non-electrolytes circulating in the body remain stable. The body has 4 to 6 liters of circulating blood volume. This depends on the body size and sex. Blood is composed of erythrocytes, known as red cells, leukocytes, known as white cells, and platelets, known as thrombocytes. Platelets are the blood cells that are carried in the plasma. The plasma proteins and colloids contribute to plasma colloid osmotic pressure. This helps keep fluid in the vascular compartment. Anything that alters body fluid volume also alters plasma volume. Plasma volume can affect blood pressure as well as affect circulation. Body fluids are either intracellular within the cell or extracellular outside the cell. Potassium is the predominant electrolyte in the intracellular fluid. Extracellular fluid, also known as ECF, is of three types: intravascular, interstitial, and transcellular. In your textbook on page 439, you will find table 25.3. Again, this lists the body fluid distribution for your review. The extracellular fluid makes up approximately a third of the body water. It transports nutrients, oxygen, and waste products to and from cells. It is regulated by renal, metabolic, and neurologic factors. The extracellular fluid is high in sodium content. Therefore, sodium is the predominant electrolyte found in extracellular fluid. Intravascular fluid is the fluid within the blood vessels. It consists of plasma and fluids within the blood cells. Intravascular fluid contains large amounts of protein and electrolytes, which help maintain intravascular volume. Transcellular fluids are the body fluids with unique compositions. Transcellular fluids include the fluids found in your eye, your aqueous humor, saliva, cerebrospinal fluid, pleural, peritoneal, synovial, and pericardial fluids, your gastrointestinal secretions, the fluids found in the urinary tract, as well as fluids in the lymphatic system. Now let's move on to discuss movement of fluid and electrolytes. The amount of fluid leaving the body should be balanced by the water entering it. Water is taken in through ingestion of fluids and foods, and it is produced by cell metabolism. The thirst mechanism located in the hypothalamus helps control fluid balance in the body. It regulates thirst based on concentration of electrolytes and solutes. The kidney is the main organ through which fluid excretion is achieved. Urine output is affected by several hormones, particularly ADH, aldosterone, and ANP, your arterial natriuretic peptide levels. Diffusion is a form of passive transport. It is the process by which substances freely move back and forth across the membrane until they are evenly distributed throughout the available space. Substances move from high to low concentration until the concentration on both sides of the membrane are equal. This is called movement down a concentration gradient. Glucose, oxygen, carbon dioxide, water, and other small ions and molecules move by diffusion. It is a process of equalization. Here you have figure 25.2a found in your textbook on page 440. This example shows diffusion, where molecules move from greater concentration to lesser concentration. Osmosis is another passive transport method. It refers to the movement of pure solvent, also referred to as liquid, across a membrane. When there is a difference in concentration of fluids in the various compartments, water and other fluids move from the area of less solute concentration to the area of greater concentration until the solution in the compartments are equal. This takes place via a semi-permeable membrane. Here you have figure 25.2b, osmosis. Here you see the molecules move from lesser concentration to greater concentration. You can find this example in your textbook on page 440. The third method of passive transport we will discuss is filtration. Filtration is the movement of water and suspended substances outward through a semi-permeable membrane. The pumping action of a heart causes hydrostatic pressure, which is pressure exerted by fluid, within the capillaries. Hydrostatic pressure causes fluid to press outward on the vessel. That force promotes filtration, forcing movement of water and electrolytes through the capillary wall to the interstitial fluid. Fact check. What organ creates hydrostatic pressure within the capillaries? Well, we just discussed that. That organ is the heart. Figure 25.2d is an example of filtration. This can be found in your textbook on page 440. Filtration is the movement of molecules between a semi-permeable capillary membrane. Let's discuss the difference now between passive and active transport. Active transport, contrary to diffusion, osmosis, and filtration, requires cellular energy. This force can move molecules into cells regardless of their electric charge or the concentration already in the cell. Active transport may move substances from an area of lower concentration to an area of higher concentration. The energy source for the process is your adenosine triphosphate, or ATP. ATP is produced during the complex metabolic process in the body cell. Enzyme reactions metabolize carbon chains of sugars, fatty acids, and amino acids, yielding carbon dioxide, water, and high-energy phosphate bonds. Active transport can move amino acids, glucose, iron, hydrogen, sodium, potassium, and calcium through the cell membrane. Figure 25.2c can be found in your textbook on page 440. This is an example of active transport. Active transport may move substances from an area of lower concentration to an area of higher concentration. Fluid volume deficit. Let's review patients who are at risk for fluid volume deficit. So ask yourself, what situations would put your patient at risk for fluid volume deficit? Well, it would be your patient who's experiencing poor swallowing, has a decreased sensation for thirst, an individual with weakness, patients who are disoriented or in a coma, or those who don't have available water access. Also, patients at risk for fluid volume deficit are those who lose an excessive amount of fluid, be it by vomiting, diarrhea, hemorrhage, or excessive diaphoresis, or wound drainage. Fluid volume deficit can result in dehydration. Patients who experience excessive vomiting can experience a drop in blood pressure. This is because the intravascular fluid, which is a type of extracellular fluid within the blood vessel, shifts from the plasma in the vascular space out to the interstitial space. This shift causes a drop in blood volume. When a fluid deficit occurs, it causes loss of water from the cells. This is dehydration. When there is too little water in the plasma, water is drawn out of the cells by osmosis to equalize the concentration, and the cells shrivel. Dehydration is treated by fluid administration either orally or intravenously. What are some signs of dehydration? Box 25.1 in your textbook on page 441 has examples of signs and symptoms of dehydration. Please familiarize yourself with these common signs and symptoms. Figure 25.3 can be found on page 441. This is testing this tissue for turgor and signs of dehydration. Here you would pinch the skin between your fingers. If the skin stays pinched, the patient is dehydrated. Fluid volume excess refers to when an individual has an overload of fluid on board. So healthy people do not ordinarily drink too much water. When people become ill, they may take in more water than they can excrete. This can happen if they receive IV fluids administered too quickly, or given tap water enemas, or are persuaded to drink more water or fluids than they can eliminate. If this event happens, the individual can suffer from fluid volume excess. Here are some signs of overhydration. When you're assessing your patient, you want to be cognizant of these signs. Signs of overhydration include weight gain, crackles in the lungs, slow bounding pulse, elevated blood pressure, and possibly edema. Remember, when you're assessing your patient's weight, you want to ensure that you measure their weight at the same time every morning to monitor fluid excess. When a patient is placed on fluid restrictions, the allowance of fluid should be given mostly during the day. So again, the greatest amount of fluid should be administered during the day shift. And why is that? Well, this is because the last thing you want to do is provide your patient with most of the fluid allowance during the evening or night shift, because they should be sleeping at night, not having to get up to go to the bathroom. Example 25.4 can be found in your textbook on page 442. This is an example of pitting edema. You want to push your finger on the top of the patient's foot or ankle. If the indentation remains, the patient is retaining fluid, as you can see here in this example. Electrolyte imbalance in sodium. A form of electrolyte imbalance is hyponatremia. This is a deficit of sodium in the blood. This occurs when the sodium is less than 135 milliequivalents per liter. Sodium deficit can be from decreased sodium or increased water intake and retention. It may be caused by excess vomiting or diarrhea as well. Hypernatremia, on the other hand, refers to sodium excess. That is a sodium level greater than 145 milliequivalents per liter. Most commonly found from individuals from water loss from fevers or respiratory infection. Hypokalemia refers to a potassium level of less than 3.5. This occurs with excessive potassium or loss of body water, which may be a result from poor diet, vomiting, diarrhea, excessive sweating, or diuretic therapy. On the other hand, hyperkalemia is when the potassium range is greater than 5.0. Please refer to your textbook on page 444, table 25.4, and familiarize yourself with the electrolyte imbalance and their associated ranges. Hypocalcemia occurs with nutritional deficiency of calcium or vitamin D, or in bone disorders such as metastatic cancer of the bone. Hypercalcemia, in most cases, are related to hyperparathyroidism or malignancy such as multiple myeloma. Hypocalcemia is when the calcium level drops below 8.4. This can occur from nutritional deficiency of calcium or vitamin D, occurs in disorders in which there is a shift of calcium into the bone. Hypercalcemia is when the calcium level is above 10.6. Again, most cases are related to hyperparathyroidism or malignancy in which there is metastasis with bone resorption. Hypomagnesemia is when the magnesium level is less than 1.3. This results from malabsorption, malnutrition, renal tubular dysfunction, thiazide diuretic use, excessive gastric suction, or diarrhea. Hypermagnesemia refers to a magnesium level greater than 2.1. This occurs only in the presence of renal failure. Examples of anion imbalance include hypochlorimia. This is when the chloride level is below 96 milliequivalents per liter, and it is associated with hyponatremia. Hyperchlorimia is when the chloride level is above 106 milliequivalents per liter. It occurs along with hypernatremia and is a form of metabolic acidosis. Another example of anion imbalance includes hypophosphatemia. It occurs when the levels of phosphate falls below 3.0. It may result from the use of aluminum-containing antacids, from vitamin D deficiency, or from hyperparathyroidism. Hyperphosphatemia is when the phosphate level is greater than 4.5. This is mostly associated in renal failure. Okay, let's review some quick takeaways regarding the content we've covered so far. So in measuring liquids or individual, if you're measuring their fluid intake, just remember a cup of liquid is equal to 240 mLs. Let's do a quick thinking check here. When electrolytes are in a solution, they break up and become what? Do you recall? The answer is ions. Again, when your electrolytes are in a solution, they break up and become ions. Remember that positive ions are referred to as cations. The negative ions are referred to as anions. Which of the following is a non-electrolyte? Is it A, magnesium, B, amino acids, C, calcium, or D, phosphate? The correct response here is B. Amino acids is a non-electrolyte. Next review question. A patient has a potassium blood level below 3.5. This is referred to as A, hyperkalemia, B, hypokalemia, C, hypernatremia, or D, hyponatremia. Consider your response for this question. The correct response is B, hypokalemia. Let's test your knowledge. For the accurate measurement to detect if your patient is retaining fluid, you would measure the weight with the same scale and, is it A, each morning before breakfast after the patient has voided? Is it B, just before bedtime while the patient is in a hospital gown or pajamas? Is it C, in between meals, dressed in light clothing after voiding? Or is it D, each day at noontime before lunch, dressed in light clothing? Consider your response for this question. The correct response is A. The weight is measured at the same time every morning on the same scale after the patient has voided and before eating. Okay, some additional questions. Question 1. Kimberly's patient is on strict intake and output measurements. That is strict I's and O's. Her patient's total output is 2,200 mLs. What should the total be for an average adult? Is it A, 1,200 mLs, B, 2,000 mLs, C, 2,400 mLs, or is it D, 3,800 mLs? The correct response to question 1 is C. An average output for an adult is 2,400 mLs. If Kimberly's patient has an output of 2,200 mLs, this could be considered within normal limits. Question 2. Which is the predominant electrolyte found in extracellular fluid? And which is the predominant electrolyte in intracellular fluid? Is it A, potassium and sodium? Is it B, calcium and magnesium? Is it C, sodium and potassium? Or is it D, magnesium and calcium? Let's see what you have for a response here. The response should have been C. Sodium is the predominant electrolyte in extracellular fluid. And remember that potassium is the predominant electrolyte in intracellular fluid. Question 3. Amanda's patient is going home from the hospital. Her patient has a history of congestive heart failure. She includes in her discharge teaching for the patient to weigh herself. Will she instruct her patient to weigh at the same time in the evening on the same scale, wearing the same clothes? Is it B, in the morning with the same scale and the same clothes? Is it C, weekly in the morning with the same scale and the same clothes? Or is it D, weekly in the evening with the same scale and the same clothes just before going to bed? Well, it should be B. Tracking daily weights is one way to assess for any changes in the fluid balance. Weight is measured at the same time every morning in the same clothing on the same scale. Question 4. After Amanda's patient goes home, she notices her rings are tighter around her fingers. She has gained 5 pounds in 2 days. She's experiencing fluid overload. In fluid overload, a patient's vital sign changes. Which of the following might we anticipate regarding the blood pressure? Will there be a rise in the systolic blood pressure, a rise in the diastolic blood pressure, a fall in the systolic blood pressure, or a fall in the diastolic blood pressure? The correct response is A. With fluid overload, there will be a rise in the systolic blood pressure. A bounding pulse is also associated with fluid volume overload. We're going to end this presentation with one final bonus question. You are comparing sitting and standing vital signs for a patient who has been diagnosed with dehydration. The pulse for this patient has increased by 10 beats per minute. You would then anticipate the blood pressure to show what? Is it A drop of 20 mm's Hg? Is it an increase of 5 mm's Hg? Is it a drop of 5 mm's Hg? Or is it an increase of 10 mm's Hg? The correct response to the bonus question is A. A drop in systolic pressure by at least 20 points is accompanied by a pulse rate increase of at least 10 beats per minute. Following position change is suggestive of fluid volume deficit. In other words, a sign of dehydration. Let's take a break from reviewing chapter 25. I'll see you soon.